Last hour, I took the honorable members through two public health events that we are managing. One is the Lassa Fever outbreak in Nigeria at the moment, which is a real public health emergency that we are managing together with many other colleagues, parastatals, and the coronavirus outbreak, which is an outbreak in China, many kilometers away from Nigeria, but because of its unique nature, the fact that this is a new virus that we're dealing with presents unique challenges in our ability to prepare to respond if necessary, but also to protect Nigerians in different ways. So I briefed the members of the House primarily first on the Lassa Fever outbreak. We've had 364 confirmed cases this year so far and 47 deaths. Now the good thing is that we have reduced the proportion of patients that die from this disease from about 24-25% to about 13-14-15%. So just 15% of individuals that are infected with Lassa now die from it. And this is really as a result of our improvement in surveillance, awareness, the care provided by some amazing Nigerian doctors providing care for these colleagues, doctors, nurses, and the whole medical teams across the country. But 70% of our cases are still reported from 3 states, Ondo, Edo, and Ebonyi. And the care centers in the Federal Medical Center, Owo, Irua Specialist Teaching Hospital, and Alex Ekweme Teaching Hospital in Abakaliki really need to be recommended for the incredible work that they're doing. But still, every death of every Nigerian is one death too many, especially from a disease like Lassa. So we encourage the members to help us continue to educate Nigerians on what causes Lassa. Lassa is caused by a virus that is transmitted by rats. And we have a simple measure of if we are able to prevent those rats from getting access to our food, we will prevent Lassa. But at the moment we are faced with a situation where there's a lot of refuse around our country that attracts rats into our homes. If we don't keep our kitchens clean, the rats will come and enjoy the food that you want to enjoy the next day. You come out the next morning, there's no way of knowing that you have shared that food with some other animals. So this is really the challenge we face. So we have to continue educating Nigerians. At the moment we don't have a vaccine, there's no magic bullet, but together we can really control Lassa. So I think the honorable members were happy with our response so far, promise to keep supporting us in finding more resources to continue working across the country to prevent Nigerians from getting infected and those that are infected from dying. The second disease that we faced today was on the what we call the novel coronavirus. Novel stands for new. So this is a new virus that has recently jumped the animal-human barrier and started being transmitted in humans. This is an outbreak that is predominantly in China. There are over 20,000 cases now and about over 300 deaths, and this is rising every day. But still, the critical thing to say is what we know at the moment about this new virus is that it is not the killer virus as being described. It is new. There's a lot to learn. We are learning very quickly. Our team at NCDC is learning every day about this virus in order to protect the health of Nigerians. On Saturday, we set up the facilities to be able to detect this virus. If there was a case that came into Nigeria, we will support, do the same in Lagos before the end of this week. We are continuously monitoring the situation in China. The colleagues working in port health services have increased their screening at the points of entry at the airports. Across the health infrastructure, around all the MDAs, that have something to do with this. Everyone is working very hard to prevent Nigerians from becoming infected from the coronavirus. So really, all hands are on deck to prevent this disease from entering Nigeria. In terms of our collaboration with others, the primary strategy the global community has, and this is not just Nigeria, is to stop the outbreak in China, right? 99% of all cases have been in China. There have been a few cases exported to other countries, 23 events right now, but all of that have been limited to a few cases. There hasn't been any sustained transmission in any other country outside China. But we are continuously monitoring the situation. It doesn't mean that this can't happen, but at the moment, we've prevented this from happening. But the viruses that we fight don't respect the borders that we hold there. They don't require visas. So we all have to be very careful and continue doing the work that we're doing very diligently. So we're working with WHO, the Africa CDC, the West Africa Health Organization to make sure that we have a collaborative approach to containing this disease and making sure that we prevent its entry into Nigeria, but if it does enter, that we have the ability to detect and then to respond. So we concluded by agreeing on some priorities for the future. Mr. Speaker thanked the team working in NCDC and Port Health Services and everybody working to stop this virus from entering the country. I think the honorable members were much more satisfied with their understanding of the situation. I assured them of our continuous efforts to protect the health of all Nigerians, and they assured me of the continuous support of the House of Representatives to grow the work we're doing. We cannot grow this work without sustainable and stable funding. So really, I think every outbreak is an opportunity, and this was one that we are using to say, listen, we face the threat of infectious diseases. We have to prepare for this ahead of time and not when there's already an outbreak. And I think the honorable members of the House of Representatives were very supportive of this and promised to help our efforts as we work very hard to protect your health and the health of all Nigerians. China. You see, it's very important in the work that we do for countries to stay open because people need to travel, both to respond to the outbreak, to buy commodities, and to learn from each other. And every country is susceptible to outbreaks. We are susceptible to outbreaks as well. In fact, we have a Lassa Fever outbreak at the moment. And we don't want other countries to stop Nigerians traveling abroad because we have an outbreak. So I think the recommendation globally is to stay open, but to take every required precaution. Advise when you're entering, measure your temperature, provide facilities to test. So we're doing everything else possible to prevent and detect. But at the moment, we're not restricting travel to and from China. Reducing the mortality from Lassa is really as a result of a series of actions. So previously, many people would die. You see the obituaries in the newspapers. He died of an unknown illness. And sometimes your doctor will tell you he had resistant typhoid or something like that. What we have done is threefold. Firstly, we have increased the awareness of all doctors in Nigeria that we now have the ability to test for Lassa. And the quicker you get into a hospital, the more likely you are to survive. Secondly, we have increased the number of Lassa fever testing labs from 2-3 years ago to 5. So at the moment we have 5 molecular labs, and these are complex labs that are able to test for Lassa, and we have started using a sample transportation system to get the samples from wherever it is in Nigeria to the lab within 24 hours. And thirdly is that the expertise of the clinicians managing these patients has improved so much over the last few years. The challenge at the moment is if you can't get into the hospital on time. But if you get into one of our key treatment centers on time, the likelihood is that you will survive. And the more people survive, the word gets round, so people are now bringing out their patients instead of hiding them at home or taking them to spiritualists or whoever they used to take them to. So it's an improvement in the system. Now, it's not a magic bullet, but there are no magic bullets. Even vaccines are not magic bullets. You still have to get them to people to use. On the second question you asked on the incubation period for the novel coronavirus 2019, you're absolutely right that there's an incubation period. What it means is that between the time you get infected and you have symptoms, it's a period where you're well like anyone else, right? And you're right that when you cross the airport at that time, the thermal scanners will not pick you up because you don't have a fever. So our strategy, if you look at all the advisories that we've been offering, is to tell if you have come back from China in the last 14 days, if it is possible for you to self-isolate, to stay at home for 14 days, then please do so. If for some reason you develop symptoms during those 14 days, our advice to everyone is to call NCDC on our toll-free number. It's on our website, and we've shared it through all sorts of media outlets, so that we will send a team to get a sample from you, so that you don't go into a hospital, because we don't want you going into a hospital and infecting others. So at the moment, if you have a travel history, if you have come back from China within 14 days and you develop symptoms, we will send a team to get a sample and test you. So we're doing everything possible to prevent transmission in Nigeria. And this is really a collective effort around many teams, both in Abuja, Lagos, and all points of entry across the country. Nigerian ambassador to China. And as far as we know, there hasn't been any infection in any Nigerian living in that province or anywhere in China. They are in touch with most Nigerians that want to be in touch with the embassy. So as far as they know, there's none. We are continuously in touch with the ambassador, and if there's any change in what we're doing, we will agree on that. But at the moment, we don't know of any Nigerian infected. If there is, we'll have to decide on the actions once they happen. They are unlikely to be coming through the land borders to Niger Republic. But having said that, you're absolutely right. We do have a challenge with our land borders. There is government presence in some of them. In Idioroko, you go there, you see Port Health Services today. But our land borders are a challenge, and I think the relevant government agencies and ministries and parastatals are doing their work. It's not NCDC's role to police our borders. The minister has said that we are ready. Readiness is a relative term. We can never, when you work with infectious diseases, with viruses, you can never be 100% certain. Some of the biggest countries in the world, the US, have had 8 importations, despite all their public health measures. The critical thing is that the country hasn't come to a standstill. They have found those cases, made the diagnosis, taken them to a treatment center for treatment, and have prevented further spread. So I think what the minister has meant by that statement is that we are putting everything in place that we can. He has given us marching orders. All the agencies responsible are working together. Every day we do a risk assessment at the NCDC. We have an emergency operations center set up for this. We're monitoring the situation literally every hour. So we are working. So I'd like Nigerians to be confident that the relevant agencies are doing their very best. What I cannot guarantee anybody is that there will never be a case of importation into Nigeria. But if we did have a case, we have the facilities to detect, confirm, and respond.